Okay, for today, working on bilateral ilial rotation. That's your hip bone. Could be dipping down or back on either side. And the majority of us stand on our right leg, which tends to favor this rotation where we get tighter in the right bum and the left inside of the thigh, called the adductor muscle. So what we want to do is we want to check that out. One thing you can do is visually, you can stand, palpate these bones. If you turn and look in the mirror, sometimes you can notice that one side is higher than the other. The side that we typically will find is that with the right side being tighter in the glute, is that we'll find a higher right side and it'll be tipping upward. So what we want to do is find out if that is what's going on. So if you grab the insides of your thighs here, just on the inside there, if you go pretty deep, you can feel that those muscles are tight right around the knee, just above it. If that left side is significantly tighter, that's a good indication of that downward pull on the left side. Doesn't mean that you can have to be twisted on both sides, but the majority of the time, if that right side's really tight, the left side's going to be doing the opposite. So what we want to do today is taking a ball, can be a dollar store ball, tennis ball. I like to do baseball. It's meaner, gets in there deeper. So the first thing to do is we're going to lay on the baseball, and you find the top of your hip bone as you bring your thumb down your back. Find where it runs into your hip bone. Go down 2 inches from there, and you're going to lay on your back. From there, that might feel pretty sore. I want you to tip your knee on the right side over so that it is pushing on that muscle. I want you to hold that. So go ahead and relax. Find that sore spot. It should be pretty tight. And you can do a little bit of a wiggle side to side to try and get that to let go, or you can hold still. As you're holding still, it should eventually work into getting deeper and deeper into that muscle. And people are looking for the release here. And so the release means that the pain will go down, or they don't feel that it's as tight as it was when you began. So that's the first place, working on that right glute. And you can explore that area. You can go up and down from that spot. Find the spot that hurts the most. That's typically a good indicator, and that's where you're holding your tension, is right back there. The next spot, for another minute, is you're going to lay on your stomach and just put this ball just above that knee, right on the inside of your thigh there. You find the spot that feels tight, sore. It might not even be sore, it might just feel tight. It might not feel the same here or here, but right in the middle. Once you find that spot again, just find a comfortable position. If you don't want to stay up like this, you can lay all the way flat, just relax into this position. I'm trying to get that to let go. I'm trying to find that adductor magnus muscle that pulls that leg inward, but it also pulls down on that pelvis, pulling it forward and down. We're trying to get that to release. It might get kind of grumpy in there. Sometimes you might even feel a little bit of a nerve pain. If it's too painful and really uncomfortable, try going up a little bit. Sometimes not being as close, a little bit into some more tissue, will make it so it doesn't hurt as much and not feel as nervy. So that's the second position, to release for 1 minute. After you've released it deeply, we've gone deep into those fibers, trying to have a connection to our brain, just tell it that that's what needs to happen. It needs to let go so that this action can occur. The next one is you get to stretch. So laying back down on your back, you pull your knee up and across your right knee to your left shoulder. You can explore that range here, around in there, finding which fibers of the hip and then the glute feel the tightest. Once you find those, I want you to hold it for 20 or 30 seconds. Find that, you can do a little rocking motion. There's nothing wrong with that. Or you can just sit there and hold it. As it releases, it should get a little bit further and a little bit further. Shouldn't be the most comfortable place. We do a lot of sitting during the daytime, or even a lot of standing. And both of those can make those glutes pretty tight. The second position for that, bend your left knee, cross your right foot over your left knee, reach your hands through, and if you can get to your knee, wonderful. If you can't, grab behind that thigh and just pull it up towards you. And that should stretch just a little bit lower and deeper into that hip area, getting the piriformis muscle, and then tip just a slight bit to the left. And again, you're just finding that tight spot. Try to make it pull and stretch. Do that for 20 to 30 seconds. And if you feel that these muscles need more stretching than that, I want you to repeat it 2 to 3 times. Try to get those muscles so that they're not so tight anymore. So again, that's the right side. Switch over to the left side. The first stretch for that, we're trying to get the inside of the thigh. You pull that knee up and out. So you're grabbing underneath and onto the front of the knee and pulling upward and outward. And you should be able to find a range there that feels pretty tight. You can play with that, move that a little bit, or you can hold it. That's the first stretch. Another way to do the same stretch is you lay on your stomach, put that knee upward and outward, and as you roll back into it, you should feel that start to pull. It should be starting to get tight there. And again, I want you to hold this for 20 seconds, 30 seconds, and try to get that to let go. If you need to, repeat it several times. So that's the way to release those two actions that are occurring, that are twisting those ilium or those hips. Now we want to strengthen it. Use the strength of the opposite muscles that oppose that to help also work into this direction. So the first one is the right hip flexor. I want you to lay on your back. And I want you to put your arms above your head and reach your left hand to your right shin. That's going to activate your hip flexor on that right side. And as you pull there, that should help pull that hip forward. It's the opposition to the right glute. I want you to do 15, 20 of those until you're feeling tired. Feel like that's working. The next one on the left, I want you to lay on your stomach. And just the opposite to pulling backward is going upward. The trick to this is I want you to try and keep that toe from rotating outward. I want you to point that toe inward if you have to, so that you're really feeling that in the glute muscle here. Do 15 to 20 of those until you're feeling tired. As you're lifting the left leg, you're also pushing with the right leg forward. So again, you're activating that right hip flexor to help correct that rotation. The last one I want you to do is standing. I want you to bring this right knee up high as you can. At the very top, I want you to give it a little resistance. Bring it up, give it some pressure. Like that. You can do that fast or slow, but give that little bit of resistance at the top range, and we're trying to rotate that hip. And same thing standing. I want you to stand as straight and tall as you can, suck in that stomach, and kick backwards. Again, do not let that toe turn outward. I want you to keep that toe facing straight forward as you're kicking to really feel it in that butt muscle. There you go. Check it again. See if you feel like that right hip is higher than the left hip. Also, you can recheck here. Feel if you're as tight as you were when you started on the left. Adductor magnus there on the left.